wanted to give you a video answer to that case of the week. So here we have an older gentleman with chronic, somewhat uncomfortable, but not terribly painful, what looks like very advanced chemosis. Almost unilateral, a little teeny bit in the other eye, but mostly in the left eye. So the most common cause for chemosis is chemosis, related to some sort of an allergy or a chronic foreign body or something of that nature. Now, could it be a conjunctival cyst? It could be, but they tend to be a little more localized than diffuse chemosis like that. Could it be conjunctival chalasis? That's possible, but that's usually bilateral. And chalasis looks different. It kind of drapes over the lid. This was very, very, very swollen, very engorged conjunctiva. Saw him week after week after week. Steroids, antihistamines, ice packs, nothing got it better. So then you have to start to say, what's going on here? I start to worry about it at that point, because if it's not resolving, and he had no symptoms of itching, by the way, if that is not resolving, something is there pushing fluid forward. So what kind of things do you think of? Well, we have to think of some serious things. Things that are obstructing the venous flow or the lymphatic drainage in the orbit. So what could that be? Well, oddly, it can be associated with thyroid. So I did thyroid function tests, totally normal. Okay, so what more serious things can it be? Well, it can be an orbital metastasis of a tumor from elsewhere. It can be a primary orbital tumor, or it could be something in the brain, perhaps a cavernous sinus thrombosis or a carotid cavernous sinus venous fistula, or it could be a brain tumor, things like that. So I got a MRI of the orbit with and without contrast. I got an MRI of the brain with and without contrast, thinking for sure that I was going to find something. Nothing. So that's good. So we've ruled out the simple things like allergy. We've ruled out the kind of simple things like thyroid. We've ruled out the super serious things like tumors and fistula and things like that. So what is it? So this is interesting, and I learned something because I didn't know about this. So I was looking things up on the internet. I was going everywhere, and some obscure paper I came up with that the drug amlodipine, which is a fairly common antihypertensive medication that people take for simple hypertension. And I called the patient's son, and I said, so, because he wanted to know the results of the scans and everything, of course, I explained it to him, and I said, so, does he have high blood pressure? He goes, yes. I said, what medication is he on? He says, oh, amlodipine. So I said, go to your internist, stop the amlodipine, start another antihypertensive. He said, okay, right away. They did. 3 weeks later, boom, gone, done. And I have to tell you, it never crossed my mind. I didn't even know about it. So I presented this case for a couple of reasons. Primarily to go through the differential diagnosis of conjunctival swelling, particularly with respect to the possibility of tumors and serious things. And then, obviously, you're not going to see too many amlodipine chronic conjunctival chemosis. It wasn't so much for that. It was more for the workup and for thinking like, if it's not getting better, we got to dig deeper and deeper and deeper until we find a cause. Anyway, thanks for all of your responses. Some well thought out, as always, good responses. And I got another case for you coming up pretty soon. Thanks again for participating.